Hello everyone and welcome to another episode of Careercast. I am Ashia Sharkar.
And I am Shireen Majumdar from Class 12 at Mahadevi Birla Shishu Vihar, and we are your hosts for today's conversation.
We are absolutely thrilled to interact with someone whose work has had a huge impact on the way people understand and approach mental health, Dr. Sanjay Garg. He's a highly respected senior consultant psychiatrist at the Fortis Institute of Mental Health who has dedicated his career to helping people of all ages overcome mental health and behavioral challenges. His experience is truly incredible. From working with the National Health Service in the UK and teaching at the University of Glasgow to holding key positions in organizations like the Royal College of Psychiatrists, the Indian Medical Association, and the Indian Psychiatric Society. We are very excited to hear about his insights today, which we are sure will inspire students aspiring to pursue this career. Good morning, sir.
Good morning.
Sir, our first question to you for today is, what initially drew you to psychiatry and how has your perspective on the field changed throughout your career?
First of all, I would like to thank Mahadevi Birla Shishu Vihar for giving me the opportunity to talk about mental health. It is an important issue because there is no health without mental health, and unfortunately mental health remains very stigmatized. So the more we talk about mental health, the more people we can involve in getting mental health as a profession. It is good for us, it is good for the society. So many thanks for yourselves for arranging this. When I talk about my interest in psychiatry and the reasons why I chose psychiatry is when I was training as a medical student, I realized the fact that psychiatry plays an overarching role over the whole different subjects of medicine. So whether it be surgery, whether it be medicine, whether it be pediatrics, orthopedics, there is an element of psychiatry everywhere. And in fact, if you think about the fact that when we talk about physical health, it cannot be on an individual basis without the mental health being there as well. And of course, when you talk about mental health, it not only affects an individual, it affects their behavior, it affects their feelings, it affects how they function as an individual. It not only affects them, but the whole people around, families, the society, etc. So that is what drew me to psychiatry, because it is something could change the whole concept of an individual or the individual's well-being. We do realize the fact that brain is the master organ and the mind is it which drives it. So the connection between the brain and mind is very important, and it sort of defines us as individuals. So all of these things I find very interesting. I think they are something which is very enigmatic, and I find it something which drew me towards mental health. When I look back and reflect upon my career over the last 25 years, I think a lot has changed over these 25 years. Especially young people like you are much more willing to talk about mental health, much more willing to seek help in terms of mental health. And we are doing more and more working towards raising awareness about mental health, like today's podcast. So I think there is a huge shift in the approach to treatment of mental health as well. Previously, we would focus on what are the problems that an individual has, but now we focus on what are the strengths the individual has, how we can increase them, multiply them, and empower the individual to become more resilient to face the challenges that we say as in day-to-day society. So I think the whole concept of mental health treatment has changed. At the same time, we are also thinking more and more about prevention in mental health. Previously, we would only think about treating an illness. Now we are thinking about how we can prevent mental illnesses as well. So that has been a huge shift in the whole gamut of mental health concept and the treatment.
Thank you, sir. That was an insightful answer.
Now, sir, we would like to know what are some of the key challenges you think that young professionals tend to face when starting out in psychiatry, and how can they best prepare for it during their academic years?
That's again a very good question. What we need to understand first of all is that in any career, there is a gestational period. So you can't hurry and sort of do things in a day. When I first started like I trained in UK, then I came back to India in 2011. And the first month that I was practicing in Fortis, I just saw two patients in one whole month in terms of the OPD. So what we need to realize sometimes what happens when we are young, we are very sort of enthusiastic, we are sort of have all the hormones running and we are very rushed. So we need to understand that any career, whether it be psychiatry, when it be any other field, and especially in psychiatry, you need to give it a bit of time, you need to give it a bit of patience. So you cannot expect to have a full clinic on the first day itself. The career builds up gradually. So you need to be able to have that bit of patience, that bit of understanding, that if you continue to persevere, if you continue to do your hard work, and if you continue to do what you know best, then gradually your career will improve. That's the first thing. The second thing is that we understand that yes, a career in psychiatry is not easy, because unfortunately most of the industry is now concentrated in corporate hospitals, and unfortunately in corporate hospitals, in except Fortis does wonderfully in terms of mental health, but not in all corporate hospitals mental health is a big thing, because unfortunately we are not the highest revenue generating people. So as a result of which, sometimes the corporates are not keen to have many psychiatrists on board. So you need to be able to understand that and plan your career path accordingly. Though I would say there is a huge dearth of psychiatrists and there is no dearth of patients. So if you have a bit of patience, you will get your patients, you will have a good practice. The other important thing to remember is that in mental health, or in any field of medicine for that matter, the word of mouth publicity is the best thing. So if you work with your patients, if you are providing them a good service, they will automatically bring other patients. So you have to have that approach when you're seeing a patient, that you have to be able to give them your best. You need to be able to understand them. You need to be able to support them. And as a starting professional, you need to be available. You need to be make sure that when the patient wants, you are there to help them and support them. That's important even as a practicing psychiatrist later on as well. But as a budding psychiatrist, when you're just starting, these are the important things to keep in mind. At the same time, I would also suggest that have some work-life balance. So don't run around, don't spend the whole week running around for patients or working, etc. You need to remember that your mental health, your physical well-being is also important. So you should be able to have a balanced work life.
Thank you, sir. I'm sure that would be really helpful for all of us. Sir, could you throw some light on the essential qualities or skills a person needs to have if they want to pursue a career in the field of psychiatry or mental health services today?
That's a good question. See, it again depends upon individual to individual. So we all have our own skills, we all have our own abilities. But if we talk specially about mental health or psychiatry, there are a few things which are core for having a good mental health practice and being able to survive in this field. One, the most important thing is patient listening. So you have to have a good ear. You have to have good communication skills. You need to be able to understand what the patient is trying to convey to you. Not every time it will be in words. Sometimes it's just the small gestures from which we pick up. So you have to be very observant about the individual. Even when I shake a hand, when an individual walks into my clinic, I can understand whether he's anxious or not, because his hand is trembling, he's sweaty, etc. So even shaking the hand gives me a lot of clues. When they're walking into my clinic, the way they sit in the chair, whether they're fidgeting, whether they're sitting still, whether they're moving around in the whole clinic, like for especially children who suffer from ADHD, gives me a clue. So you have to be very observant. You have to have a patient ear. You need to be able to develop good communication skills. At the same time, again, I would also say that in mental health, we are dealing with human difficulties on a day-to-day basis. So it is a very stressful job. It is not an easy job. In fact, in UK, the retirement age is early for mental health professionals. So you have to have a good work-life balance. You should be having friends. You should be having activities out with your work as well to maintain your own health. So those are the things which are very essential to survive in mental health.
Thank you, sir. Now, sir, what do you think are some of the common misconceptions that teenagers and young adults tend to have about mental health and psychiatric care?
Thank you for that. I think that is a very important question. One of the key things in terms of mental health is, first of all, there are lots of myths. So one myth is that, for example, children cannot have a mental health problem. But believe me, I see a lot of children with mental health issues. Two, often people believe that once you have a mental health problem, it never goes away. But as per statistics, if I see 10 patients, 7 patients can improve and lead a fully functional, healthy life. So once you have a mental illness, it does not mean that it is forever. The key part is when we diagnose and how the treatment is taken up and followed. So early diagnosis, early intervention can change the whole sort of gamut about what will happen in terms of future. The other big myth about mental health is about the medications in mental health. People often believe that they are very addictive, but what I tell my patients is that it is on a need basis. So, for example, if I have fever, I will take, if it crosses 101, 102, I will take Calpol or Crocin. So similarly, if I have a mental health issue which needs medical intervention, which needs medicines, we would give medications, but the lowest possible dose for the shortest duration of time. So it is not necessary that it means that you will be sleeping all day, you will need to get medications all day, you will need to sort of continue medications lifelong. It does not mean that. If we have much more modern medications which do not have comparable side effects as the old ones would have, and we have medications which can whole change the life of an individual. So I have a lot of individuals, for example, who were so depressed that they would not go out to work. They felt life was not worth living, and they were really facing a severe difficulty in terms of managing their day-to-day life, who are very well, who are fully functional, who are working as lawyers, bankers, etc., etc. I have had individuals where, for example, they suffer from what we call is OCD, obsessive compulsive disorder, where they have difficulties and in terms of thoughts, in terms of things that they need to do on a repeated basis, etc. So just to give you an example, I had a lady who would not put a foot out of her bed because she felt that her feet would get dirty and then she would need to clean up and do the whole thing. And she was just confined to that 6x3 bed and she would not do anything else for months and months and months. And now that lady has children, is working and supporting her family. So the important thing to remember is that mental health illnesses are like any other physical health illnesses. They have good treatment. If things are done at the right time, the person can improve, the whole family's concept can change, and you can lead a very normal, healthy life. At the same time, I would also like to mention that in mental health, it is not just about treating illness, as I mentioned before. It is about remaining well. It is about doing your best and being able to perform in the best possible manner. If you look around the world, most of the good football teams, cricket teams, individual tennis players, etc., have a psychiatrist, have a psychologist in their team so as to be able to perform in the best possible manner.
Thank you so much, sir. That actually really adds a lot of depth to our understanding. Sir, our final question to you for today is, what advice would you give to school students who are curious about mental health services and psychiatry? Are there any books, platforms, or resources you would like to recommend that would help the young learners to explore this field?
I would like to mention here that in Fortis here, we do internship program for school students, which we have been doing for the last few years and which has been very popular among school students. come and spend some time with us and understand actually what is mental health, what we do on a day-to-day basis, and see us working and interacting with students. So that is the best opportunity that I can offer. When we speak about books in terms of mental health, or we speak about resources in terms of mental health, Royal College of Psychiatrists, the body which trains psychiatrists in UK, is the best place to explore and learn about mental health. They have a lot of leaflets, they have a lot of resources in terms of links to various websites, etc., which give a very, very basic understanding about mental health, and also gives opportunities in terms of what you can do in terms of your career in mental health. So there are a lot of resources available on that website. Indian Psychiatric Society is also a good place to find out about mental health issues and look into things in terms of mental health. If we are looking at things like books in terms of not sort of psychiatric per se, then there are books like The Man Who Mistook His Wife for a Hat by Oliver Sacks, which is a good book to read if you want to understand about mental health. There are movies like Tare Zameen Pe, so those also give you a concept about mental health. So there are many things available of mental health resources. Then of course there is the World Health Organization as well. On their website as well, there are lots of resources about mental health. But please use genuine websites, please use genuine resources, because sometimes again they can add to the myths and misunderstandings about mental health.
Thank you, sir. And that brings us close of another enriching episode of CareerCast. Our heartfelt gratitude to Dr. Sanjay Garg for sharing his thoughts and perspectives, and for showing that true success comes from a blend of knowledge, empathy, and perseverance. To everyone watching, thank you for being a part of today's conversation. We hope you leave not just with information, but also the motivation to chase your dreams and goals with determination and heart. Stay tuned for more inspiring stories and untold journeys. Until next time, this is CareerCast, creating pathways to your future, one episode at a time.